Okay, so we're here with Mike the therapist, and our first question is, what are the most common mental health issues for our age group?
Okay. So, adolescence is a time of storm and stress. There's just a lot going on. I would say that probably the most diagnosed um, mental health issue for your age group would be something called an adjustment disorder. That can come with depression, it can come with anxiety, it can come with both. Um, but that's really just kind of helping people. There's a circumstance going on in their life, so it's helping people get past whatever that situation is, to reduce the symptoms of anxiety and depression. So that would probably be the number one. Number two is probably just straight up anxiety. Um, and straight up anxiety is just worrying about everything and being fearful. Anxiety holds you back from trying new things, which at your age y'all should be trying a lot of new things. Um, don't listen to this, good and bad, because you're young enough that we expect you're going to screw up. So screw up, that's a good thing. Better thing, screw up and then talk to your parents and let them guide you through it and help you figure out how to avoid that situation in the future. Third diagnosis would probably be like ADHD for your age group. Trying to focus on things. Um, Not so much the hyperactivity part, because I wish that I could have that. I don't really see that so much as a um, diagnosis. It's usually the inattentive piece, where you have a hard time paying attention and focusing.
Are there any symptoms we should know for these more common issues?
Okay. I kind of went through that when I was answering number one. A lack of focus, if you're not paying attention in school, um, if you're having a hard time following through, getting assignments done, doing them on time, all that kind of stuff. That's for the ADHD. Anxiety, it's like I was saying before, it's just fear. Oh, this is kind of interesting. Um, so I was watching the Olympics years ago, and I think it was Dominique Dawes, gymnast, and she had, I don't know, like two or three Russian girls that were right behind her. She was getting the gold, one apparatus left, which was for exercise, and for her that was her least favorite. Um, and I remember Katie Couric, I don't know if y'all even know who that is,
No.
but journalist, she said, "Are you nervous?" And Dominique was like, "No. What you don't know is I've done this routine like 1,000 times. I've nailed it 1,000 times. They're gonna go. They're gonna announce my name. I'm gonna go out on that mat. They're gonna turn on the music, and I'm just gonna blow it away because I've done it so many times. I'm excited. I am so excited to get out there and do it." So and she did. She went out there. She nailed it. She got the gold, individual all around. Um, it was in that moment. I'm watching that. And I was like, "Holy cow!" Anxiety and excitement are the same emotion. It's just the way we think about it. So if you're anxious, you think of negative things. If you're excited, you think of positive things. But you still have butterflies in your stomach when you're excited and anxious. Um, so paying attention to stuff like that. Um, Depressed mood, getting kind of like curling up into your own little cave, getting away from people. That's something that, if that starts to happen, you probably need to be talking to someone. Yeah.
So, how can people with anxiety, ADHD, depression manage those to stay healthy?
So I came across a really neat quote in a textbook. It's a husband and wife team, Corey and Corey, and it said, "How can you give away that which you do not possess?" Talking about counselors. Um, that led me to my dissertation topic, which was how does a counselor's own wellness affect how um, advantageous our skills are for our patients. So as a therapist, it's something that I have to be really, really mindful of is my own mental health and where I'm at. And the things that into, well, let me ask y'all. Each of you give me one thing that is a comfort to you.
Collectibles.
Yeah.
Sounds like a movie. Yeah.
I like drawing.
Drawing.
I guess like singing and dancing a lot.
Ooh, okay. I love to sing.
Theater.
I heard that. You're the theater kid.
Yeah.
Art, or I guess books.
Okay. A big thing is being able to communicate what you're thinking and what you're feeling. And usually it's boys that are a little bit, not a little bit, a lot slow when it comes to understanding emotion. Yeah, I'm seeing like, oh yeah, you're right. So sharing with your friends, sharing with your family, with teachers, if you're noticing those symptoms, talking about it to your support system is the number one thing. Number two would be taking care of yourself, theater and everything else that y'all were talking about. Self-care is so important, and it's actually so important. Like caring for yourself is, it's gonna sound weird. It's more important to care for yourself than it is for others, because you can't care for yourself, you can't care for others. So self-care is of paramount importance. I know that y'all are wanting to be a light in this world, in this community, so just being mindful and aware.
What are some things that everyone should do to kind of maintain good mental health?
Again, it comes back to being mindful. Be aware of who you are, what's going on in your life, emotions that you're having, thoughts that you're having. Try to stay positive. There is a super powerful thing when it comes to positive thinking. It's kind of like going back to what I was saying about excitement versus fear or anxiety. It's how you look at it. And if you look at it in a positive light, we tend to behave in a positive manner. If we look at it in a negative light, we tend to withdraw and things kind of fall apart. So it really comes back to that, honestly.
What are exercises we can do to calm our anxiety and healthy ways to manage school-related stress?
Ooh, that's a good one. So our natural defense against anxiety is breathing. It sounds stupid, but it works. If you ever watch an infant laying in their crib, they're on their back, here's their chest, and here's their little belly. And when they breathe, you'll see their abdomen rise and fall, and rise and fall. And that's how we're supposed to breathe. That's deep breathing. We learn when we're about 2 that we can cheat, and we breathe with our chest and our shoulders. So it looks like this, and that's stressful breathing. It's really cool. When I teach people to do breathing, we do square breathing. So on one side, you take a deep breath in, and for the same amount of time at the top, you hold your breath, and then you exhale, same amount of time, hold, inhale, hold, exhale, hold. So you do that like, I don't know, when I do that like 6 times, I can go from like 1 to 10, 10 being like the most anxious I get. If I do that 5 or 6 times, the square breathing, it drops me down to about a 2 or a 3. So focus on your breathing. Like if you're really feeling like really stressed over a test or something else, just put everything away, close your eyes, and breathe. It's amazing. Even people who have panic attacks, which panic attack is like the pinnacle of anxiety. It's when you feel like you're gonna die. People even have like symptoms of having a heart attack when they have a panic attack. That's the only thing in all of psychology that we can cure, and we cure it by teaching people how to relax, how to breathe. So when I do a relaxation session, number 1, I teach square breathing. The second thing I do is progressive muscle relaxation. So I have people laying on the couch, they breathe, and I get them to like, it's like an invisible line that goes across their body, and as it passes over, I have them relax their muscles. And I do something called guided imagery, where I just kind of tell you a story. Like, my favorite place, my happy place, is my grandparents' pier out on the river. so I just described that and use as many like I make sure that all of the senses are included when I think about it. Like I smell the fresh water. I can smell I can hear a boat go by and that rooster tail, and then the exhaust from the boat. You can smell the gas. Um, Temperature. The sun will heat up, and then maybe a cloud moves in front and get a little bit of a chill. Um, Hearing the water brush up against the reeds, this kind of thing. So once it's funny. I've had hundreds of people in the middle of a panic attack come in and they're pacing back and forth because they can't stop and sit still. They're hyperverbal, so they're just like can't stop talking. And I can take them from that level to in 45 minutes, just doing those things, deep breathing, muscle relaxation, and guided imagery. And in 45 minutes, they're lying on the couch snoring, like asleep, gone. It's really amazing. It's absolutely amazing. I've been doing this for like a really long time, 27 years. And it still amazes me how quickly that works, how well that works.
Okay. So in social media, there's been a lot of a thing called self-diagnosing. I'm sure you're familiar. Can we get your view on the topic?
I hate it. I hate it. I hate it. Every once in a while, it's helpful. It helps people become mindful of what's going on. But for the most part, like there's terms that get thrown out there, like being neurodivergent. That's not a psychology word. That's not in the DSM, which is what we diagnose from. And I don't know, it really bothers me. I hate hearing the word neurodivergent. Another one is, like in pop culture, people talk about others being narcissists all the time. So I'm dating a narcissist. Well, let's get into that. Narcissism does not happen that often in the population. I think it's like 4% of the population is actually a narcissist. When people are self-diagnosing and when they're diagnosing their spouse, their loved one, their family, a lot of times these personality traits will come up, and instead of just seeing it as a trait, they're like, oh no, they have a diagnosis. That's not usually the case. I wouldn't use the word narcissism for most of what people talk about. I would just say that they're self-centered, they're selfish. Narcissism is truly like, it's a personality disorder. It's one of the worst things you can have. In fact, there are 4 personality disorders. They're called cluster B, antisocial, which means like anti-society, anti-law.
Isn't that another? Wasn't that like the clinical idea of a sociopath? I think.
Borderline personality disorder is. Yep. So, antisocial, borderline personality, histrionic personality disorder, and narcissism. Those are the 4, in my opinion, those are the 4 worst diagnoses that a person can receive. My opinion, and this is just my opinion, is that our personalities are set by the time we're about 7 or 8 years old, and there's nothing we can change. There are people who work with people who have personality disorders that tell me that they've made breakthroughs with them. But when I look at it, I don't see that they've changed their personality. They've just taught them how to mask and respond appropriately in the world. For me, learning how to diagnose, we had to take, in grad school, I took psychodiagnostics, what else? Psychopathology, several classes just to learn how to diagnose. And to make any diagnosis, a person has to meet certain criteria. So I wouldn't do that with a Google search. I would find a therapist and talk that out to try and figure it out.
I know self-diagnosing. It used to be like, you know how internet always amplifies things. It used to be something like, hey, if you're noticing this type of behavior, maybe go try and talk to someone about getting diagnosed and seeing if this is something that's affecting you. But nowadays, I feel like it's self-diagnosis. I definitely have this now. And it's like, no, not, you might, but you might, it's to grow and like go.
You
Yeah.
really have to go get like a professional help.
Professional
You
opinion.
can't just go search on like
I would
WebMD
say
or
about
something.
Yeah.
80% of the people that come to see me have already diagnosed themselves with whatever. And sometimes they're right, but sometimes it's not right at all. Sometimes it's like, I'm hearing what you're saying, but those are symptoms of this problem. And when I tell them that, it's like, aha. And then sometimes people come in and go, I was thinking this, and I'm like, gosh, I hadn't even thought of that. And I go through the criteria, and I'm like, it blows my mind. Okay, cool. So it's definitely a back and forth diagnosing. I'm an expert in understanding where people are coming from and how to help them get past things, but my patients are always the expert of their own life. They know what they think, they know how they feel, they know how they behave.
Is there anything specific you would note about the process of attaining a license or learning about like becoming a therapist?
Absolutely. It's definitely a journey. So you go through college, you get your 4-year degree in something, underwater basket weaving. I got mine in psychology. Literally, to be a therapist, you only need a master's degree, which takes about 2 years, in clinical counseling or something like it. So you get 2 years of school, and then you have to do 2 years of first you have to pass your licensing exam for the state, which is fun. 200 questions. You only get to take it twice. So if you fail twice, you're digging ditches the rest of your life. That's not fun. And then you spend 2 years seeing patients with supervision from a licensed supervisor. And then once that's done, you send in your paperwork, you become a licensed therapist like I am, and you can open up your own business. So like I said, it's a 2 years of grad school. So I have my master's in clinical counseling. I also have something called an EDS, which is education specialist, and I specialize for 3 years in marriage and family therapy. Specifically, I love doing marriage and family therapy. And then I took 2 years. We had to take 2 years before you could apply for the PhD program. But my PhD is in counselor education and supervision. So all that my PhD allows me to do is to be a professor at a university, which I found out I don't like doing, so came back to this. I have a daughter. So my oldest daughter, Carolina, is going to be a psychiatrist. She just graduated with a degree in biology from USC. She's going to take this year, take the MCAT, and then apply for medical school. But she wants to be a psychiatrist. My middle daughter, Nora, just started a clinical counseling program with Liberty University. So in 2 years, she'll have her education out of the way, and then it'll be licensing time, so another 2 years. So, I mean, it takes about 4 years to be a licensed therapist if you do everything like really fast, and you pass the state exam pretty quickly.
So you mentioned psychiatry
Psychiatry.
earlier. I want to know the difference between a psychiatrist and a therapist.
Okay. So a psychiatrist is someone who goes to medical school and they become a medical doctor, and then they focus on psychiatry, which psychiatry is a soft science. Like if you're a surgeon, they know exactly what they have to do. Like they go in, they have to cut this and sew this back and put you back together. Psychiatry, it's psychopharmacological, so kind of have to go through a progression of different medications. Sometimes it's a hit the first time. Most of the time, that's not how it works. It takes time to find the right medication, the right dosage. So they're medical doctors that prescribe medication to change behavior. Counseling is different. It's psychotherapy. It's talk therapy. In my opinion, and a lot of people's opinion, this is where real change occurs. Psychiatry is, I'm not going to call it a Band-Aid because it's so much more than that. It's very important. But medications aren't usually the long-term change factor. unless you have something like major depressive disorder, bipolar disorder, something like that, where you need to be on medication for the rest of your life. Most diagnoses can be taken care of just in psychotherapy. This is very interesting. The research says about 65% of the people who come in to see a therapist get better, move on. Same with psychiatry, 65. But you put the two together and it's about 80%. So when you combine psychiatry and psychotherapy, you really, you've got the best of both worlds. Medication can help dull some of the symptoms that you're having so that you're able to talk about things that are so hurtful. That really blocks people sometimes.
Today we talked about conditions, symptoms, and how to become a therapist. We gained insight on these conditions and topics. Thank you so much, Mike, for joining us.
Thank you
Yes.
for having me.
We really
Yeah.
appreciate it.